Let's talk about collaborating with your provider and how to advocate for yourself. Hi, I'm Judith Maddatu. I'm a nephrologist from Indiana University. Welcome to this webcast from the PKD Foundation on shared decision-making in ADPKD. This is a three-part series where we will discuss the principles of shared decision-making and their importance in managing ADPKD. We'll touch on treatment options available. And lastly, we'll go through tips on advocating for yourself and collaborating with your providers through shared decision-making. We've reached part 3. Let's talk about collaborating with your provider and how to advocate for yourself. First step, I think, would be getting to know your care team. And I don't mean just knowing your nephrologist or your nephrology provider, but other members that they may work with. You may be in contact initially with your nephrologist nurse or medical assistant. And these are the folks that do know a little bit about your medical history and could be a good resource for other information about your care. My nurse is someone who helps me triage messages and who may reach out to ask how blood pressure have been ranging or how a new treatment option has been going. If you decide to be on tolvaptan or Jynarque, you will also have access to a REMS monitoring team of sorts. This would include a pharmacist who may call you to check in on how you're tolerating your medication and if you're experiencing any side effects. The REMS monitoring team has also been a useful resource for questions on tolvaptan. Okay, next step in collaborating with your provider through shared decision-making is preparing yourself for your visit. This may include taking a sort of inventory of how you're doing. So having an updated list of medications between other providers, noting any symptoms you may have. And your provider will likely ask you things like how your blood pressure has been ranging. And it would be helpful to have any recent readings, especially at home, so you can discuss tweaking your blood pressure medications. If you have any changes to your health, it would also be important to bring this up with your provider. Now, during the visit, during any healthcare visit, it can sort of feel like interrogation where your provider asks a bunch of questions and directs topic to topic. Try not to let it be a one-sided conversation. Your providers typically have an agenda on topics they wish to cover while you're there. And this agenda may be different from what you would like to discuss. It's always important to bring up questions and concerns you've had about your health or revisit previous issues if you need more information or need clarification. For instance, when reviewing labs for kidney function, some questions that might be helpful could be, do you consider my kidney disease to be stable or am I progressing faster than you would expect? Could you explain my creatinine or GFR? What are my kidney function trends? Where do I stand on the need for dialysis? Should I consider transplant options now? And when it comes to decisions on your healthcare, ask for alternatives and more detail on the need for a particular medication change or test. For instance, if your blood pressure is running high and you're considering a switch or starting medications in general, you could ask, is there anything I could do besides medications to help with my blood pressure? Is there anything I should know about this medication before I start? Do I need to have a lab check or any testing alongside this medication? Sometimes it can be definitely difficult to advocate for yourself in this regard. If you have a family member or close friend, it could be helpful to bring them along with your visit with your provider. I found that people find comfort in having someone that can provide details on what they're going through and ask difficult questions they might not feel comfortable asking themselves. Lastly, in collaborating with your provider, it's important to keep the lines of communication open. Outside of visits, you're kind of on your own, the remainder of the 365 days in a year. The responsibility of taking care of your health rests essentially on your shoulders. That doesn't mean the conversation stops with your providers. In between office visits, it's important to keep your provider in the loop. If you are having any problems, know how to contact them in case you need them or need to be seen sooner before your next scheduled visit. This could be knowing what is the clinic number, who to ask for, who's their nurse. Most electronic records now have a messaging function that allows you to contact your providers through messaging or email. Sometimes it may be difficult to reach someone over the phone, and I've found that these features are becoming ever the more useful. They allowed me to update my patients when I have labs or radiology results, and they help keep me in touch with my patients on changes with other healthcare providers. It is also important to know how to reach your providers outside of office hours. So for instance, if you're having an acute concern about a kidney infection or are experiencing symptoms you're really not sure about, it's important to know who to call. Myself, for instance, I work at an academic center in Indianapolis, and many of my patients live hours away from the clinic. They see me for PKD care, but they also have a nephrology provider closer to home, which I've found to be important for many patients to have. In addition, I do make sure that my patients have information on how to access the nephrology team after hours. For instance, calling the hospital and asking for nephrology on call if they really need somebody to talk to. Sometimes this information is not presented on a standard business card. It's not provided online. And so I encourage you to ask your providers on the best way to contact them in case something is needed in a hurry. Thank you for listening to part 3 of this webcast. And I hope you are able to have good in-depth discussions with your providers on your treatment options, and we keep the lines of communication open.